Our policy idea is called the Racial Equality in Healthcare Act. I am Emily, a history student of colour. Gala is in her final year studying political economy, and Sophia is a medical student. And so we wanted to apply a multidisciplinary approach to the issue. The issue that we felt morally compelled to address is that of racial inequalities embedded and exercised in the care and treatment of NHS patients. A legacy of continued neglect experienced by BAME people has acted as a barrier to accessing effective treatment. This can be seen in the case of BAME pregnant women. The following graphs show how Black women were 5 times more likely to die in pregnancy in studies conducted between 2014 and 2016, how infantility mortality rates were highest amongst Pakistani children in 2011, and how this has only worsened as the British Medical Journal accounts how BAME women account for over half of pregnant women in UK hospitals with COVID-19. Alongside the resurgence of the Black Lives Matter movement, which emphasised the unified frustration at the unequal treatment of Black people across the world, we believe that it has been far too long that the racial inequalities of BAME people have been left untreated, and so ask, if not now, then when?
We also cannot ignore that BAME communities have suffered disproportionately from the COVID-19 pandemic. Several studies have found that BAME individuals were more likely to need intensive care and to die from COVID-19 than their white counterparts. Some of the reasons why these effects are seen are listed in this slide. To address the injustice found in health outcomes and the urgency posed by the pandemic, we devised the Racial Equality in Healthcare Act. The policy we propose consists of a package of reforms that will address 2 overarching aims. The first aim is to improve the research and information accessible for BAME communities. To achieve this, our policy will mandate that linguistic and culturally sensitive information is provided alongside standard communication to do with health issues, that more research on how different diseases affect BAME communities in particular and in how to improve health outcomes for this group is funded and conducted, and that ethnicity is recorded in death certificates across the UK. The second aim of our policy is to improve the services provided by healthcare providers. To address this, our policy will mandate that medical students take a racial sensitivity and awareness in healthcare course before receiving their degrees, and that current NHS workers who have already received their medical accreditation take the Equality and Diversity Training course already offered by the NHS. The most relevant stakeholders of the policy are NHS doctors and workforce, the BAME community who we are targeting to benefit, and the Department of Health.
This slide has an approximate timeline of the actions laid out earlier in our policy outline. The policy will work with these institutions to update medical schools' curricula. For all practicing professionals, we ensure further education encompasses disease variation across all ethnicities, to give practitioners the tools to treat all patients with equal efficacy. With regard to guidelines, we'd work with agencies to ensure the legal guidance is thorough and clear as it tackles race, racism, and health inequalities, and considers barriers to care that BAME patients experience.